Hi, I'm Dr. Mark Lee of Cleveland Non-Surgical here in Cleveland, Tennessee. I've been a chiropractor here in Southeast Tennessee for over 25 years. One of the things with my experience I've noticed is there's a very overlooked muscle in our bodies that can affect your lower back and how your body responds to treatment and also could help prevent some problems in the future. That muscle is called the iliopsoas. Very strange muscle name, but let me explain to you what it does and where it attaches. So this is your lower back right here and your pelvis. This is a leg bone right here. So what we found is the iliopsoas actually attaches directly from the lower back spine, runs all the way down through here and attaches to the inside part of your leg. So it's actually attached directly to your lumbar spine. So if the iliopsoas muscle is not working right or is too tight, that's going to directly affect your lower back or your lumbar spine. What the iliopsoas muscle does, it's a hip flexor. So basically, to flex your leg up like this, your iliopsoas is going to be used. It brings the upper leg into flexion, your hip into flexion basically. So this iliopsoas muscle is one of the only ones that really affect the lower back spine from your leg like this. So the iliopsoas muscle, if I'm sitting like I am now, I'm not using my iliopsoas muscle at all. So basically it's cramped up here, it's tight, it's not elongated or stretched or working. So for me to lift my leg up now, that's going to actually cause my iliopsoas to work. Now today in our modern society, we're behind computers a lot, we're behind the desk a lot. We don't use the iliopsoas muscle as perhaps if we were outside working physically and using our bodies to actually make a living and whatnot. So even that, we have a tendency to become more of a lazy society, watching TV, again behind computers and our phones, so we're sitting a lot. So when you're sitting, again, you're not using that iliopsoas muscle. So it's important to make sure that your iliopsoas muscle is stretched and used correctly so that it actually supports your lower back spine and the structures of that. So I'm going to show you a stretch today. Show you a way that you can stretch, because we're still going to have to sit. We're going to have to stay behind computers and TVs and whatnot. Let me show you a way that you can stretch the iliopsoas muscle and actually help perhaps prevent or even treat some conditions that it could be causing. So it's really simple. All you have to do is just get down basically in the floor, put your knee on the floor, and then I'm holding on to a table here just for some support. But now all I'm going to do is just lean forward, okay? I'm stretching this muscle over here, this iliopsoas on my right side. I'm just leaning forward. You'll feel that pain. You'll feel it elongate, and you'll feel some pressure in there. And it's actually a good stretch. It doesn't hurt typically, but when you want to make it feel a little bit uncomfortable, not too painful, and then you know you're stretching that muscle. So I'm going to hold this for a little bit, like 10 seconds or so. Come back up, do that again. I recommend doing it 10 times per leg and 10 seconds on each leg. And it's really easy just to switch to the other side. So that's a great stretch that you can do to actually help you in your lower back and your treatment of your lower back. Hopefully get some great results through whatever care you're using. I'm here to help. If I can help you, give me a call. Again, I'm Dr. Mark Lee of Cleveland Non-Surgical, and hope you have